Hello guys, welcome to today's presentation. Now guys, today we are going to look into dosage calculation of the medication. So there are very many medication in our hospital unit, in our clinic setup, in our dispensary. There are very many types of medication there. So guys, you need to know to properly know how to calculate the dosage, especially when you're in the newborn unit, especially when you're in the pediatric unit, because you know very well now in those units that I've mentioned now, proper dosage calculation is very crucial. So guys, remember, inadequate or improper calculation of a dosage can cause a serious crisis to a patient, basically that pediatric or that neonate. Basically, we've heard of kidney failure, right? Basically, it's one of the adverse effects of most of the medication, most of the drugs that we use, guys. So, especially the most tricky drugs that they use, maybe they give many people maybe during the rotation calculation, especially in the newborn or in the newborn unit exactly. So we have these, the benzylpenicillin. So we have the benzylpenicillin, like this is the 4 mega units. So when it comes to calculation of the dosage, basically now, this is where now the pediatrics protocol manual or handbook comes in handy. So guys, remember when you are posted in that pediatric unit, where you are posted in that newborn unit, you need to have your pediatric protocol manual always close by you guys. And I promise you guys, if you go through your pediatric protocol manual, guys, you're going to be able to do everything. You're going to be able to calculate those dosage sharply, quickly, and everybody will be left wondering like, oh my God, this guy is a genius, but not a genius, just a bookworm or a reader. So guys, a proper dosage calculation, as I've said, is very important. So, especially, and also we have very risky drugs that if you mess up with the dose, you can cause death of the patient. A drug like morphine. Now, guys, maybe you've never administered morphine. Maybe now you have finished your college. Now you are hustling. You're in that clinic of yours, guys. Then there's a morphine there. Maybe it's locked. Maybe it was forgotten because that drug should be kept under lock and key. But guys, maybe you remember when you come there, you find it is there. The drug is there, and then you are tempted like, hey, this patient presents with a lot of pain, or comes in a drug abuser. Maybe that drug abuser now is telling you, please, I want to be administered with morphine. Maybe I'm going to pay this amount of cash, guys. You have never administered morphine. You know it is even illegal to administer it because basically morphine is basically used in theater. Basically, in theater units, it's where we're going to use the morphine. Now, because of you being tempted, you're never given morphine, guys, and then you get the morphine from the cabinet, you withdraw it, you administer to the patient. Now, the patient presents, the patient condition now changes rapidly and it becomes an emergency, guys. So remember, proper dosage calculation is very crucial, and the drug is even adrenaline. Now, you have never administered adrenaline to a patient. Maybe a patient now presents, you don't have maybe you don't have the common medication that you're basically using maybe for allergies, maybe like, for example, the one that I like giving or administering to patients presenting with this allergy. Maybe the allergy maybe is from eating foods that maybe they're not used. Maybe they've gone for hiking, they come back, they've been staying there in the hiking. Maybe they're just exposed to this weather. Maybe it's an asthma attack now. A patient comes in, is wheezing, and you have even sometimes maybe you're scared. I remember when I was in the ward one day. So the patient presented, it was just my first day in the ward, and the nurse was not even around. He had gone to collect some drugs in the pharmacy. So I was all alone. Now the patient comes in, he's wheezing. Oh my God, in my first day in the maternity, in the ward unit, I don't know what I'm going to do even to this patient. He was an adult. I didn't know what drug even to administer at that time because even the clinician was not even around to help me with the prescription. He just walked straight into the ward. I don't know why he missed to go to the outpatient department to meet with the clinician. Now he just present there. there like that. But the best drug that I said, basically, which drug that I'm going to use maybe for allergies, antihistamines. Basically, guys, you know the drug. I don't need to mention it, guys, because I know surely everybody genius of you knows the drug that is going basically very, very important in managing allergy or antihistamine drug. So, guys, as I said earlier, dosage calculation is very, very, very important. Now, guys, in this episode, we're just be talking, introducing the topic of dosage calculation and how important is it. Because as I've said, miss improper administration of a dosage can lead to the death of the patient, and you know that can lead to what malpractice or negligence, those aspects of nursing. So you can be charged with those with those misconducts according to your nursing law that governs you maybe in your country. So guys, what I'm telling you, proper dosage calculation is very, very important. So, in the next episode, guys, we're going to look into very common drug and their dosage calculation, guys. We are going even to look at the fluid administration, calculation of droplets. You need to know how I'm going to administer the droplet, especially again, this comes to the newborn. Hmm? And in this now, we are going to incorporate even infant feeding. Now, the newborn is feeds. How do we calculate the feeds of a newborn, guys? We are going to include here, and dosage calculation because basically now it cuts across. Because even in that feeding now of the newborn, now it comes under the dosage administration. Now, guys, let's meet in the next episode. Subscribe on these episodes, on this channel. Follow, like, comment on this channel so that when the video now drops by, you are there, you get the notification and run into the channel, get the takeaway or get what we were talking about or how to calculate those dosage, so that when you walk, maybe it is in your time, maybe it's an assessment, maybe now your teacher asks you, how do you calculate maybe the ceftriaxone now? This is a newborn, you're given with ceftriaxone 1 gram, and the newborn maybe is how many kgs? Is 4.2 kgs. Now, how do we calculate now the dosage? So guys, dosage calculation is very, very important, and it's where even you can score even the better marks. Better marks because knowing the dosage calculation, you'll run now for the doing the drug administration procedure. And when you do the drug administration procedure, guys, it becomes the most easiest procedure for you to do even during your assessment. And now you pass very well and prove to that teacher that really, mama raised no fool, guys. So till the next time.